Hello, everybody. Good afternoon. Thank you for being here and tuning in. We have weather expected to hit the community at 4 o'clock, so certainly we want everybody to be cognizant of potential storm coming in, very high winds. So we'll try to get the information out quickly today, answer some questions so that we can be prepared for what Mother Nature may have in store for us. Today is a mixed bag. Unfortunately, we have more death in the community. We've had 0 deaths at hospitals. We've had 6 deaths at nursing homes. Again, we want to just take a moment and think about these individuals who've lost their lives, their loved ones, and their families, and everybody we've lost in this process. Not just related to COVID, but anyone overall. We've now had 90 deaths related to COVID, 32 in nursing homes. We don't know a lot about what that means. We know that people that live in nursing homes, they call it home, they've died. We don't know enough if they died of just COVID or if they died and had COVID and had a heart attack, anything else. So that's just information. We don't know enough about that, whereas hospitalizations, when we lose a neighbor to that, we know that COVID was the driving force behind that loss of life. So regardless, we have 6 folks that were with us yesterday that aren't with us today. Related to testing, there have been 23,045 tests administered. 21,414 tests have been returned, 720 tests returned since yesterday, a massive number of tests coming back. There are now 1,543 positive cases, 20 new cases since yesterday. When you think about that, 20 cases, 720 tests back, those percentages are very, very strong. And we've had 19,871 negative test results. We just sent 1,217 tests from Onondaga County since yesterday. Once again, that was our county's number. Regional mandate of 775 a day. We've sent 1,200. Onondaga County alone nearly doubled that mandate. We have 1,631 pending tests. Our percentage of positive, now that we're doing proactive asymptomatic testing, this percentage is going to continue to drop. We were 8% when the guidelines were symptomatic. Now this is down to 7.2%. We will continue to do proactive asymptomatic testing next week at the Syracuse Community Health Center. So that was a big question yesterday. We got that clarified. Tim's not here, Terry. That was Tim's question. So we'll credit you for that answer. But certainly we've had a lot of success. There's still people who want to get testing. We'll do that. Today, again, we're doing our second day of mobile testing at the WIC office, our WIC office at the old No James Market parking lot. Our mobile testing is going to be done where we see trends or we don't have enough data and we don't feel we're getting enough testing in different parts of our county. So you'll see mobile testing in our southern towns in the near future. We will be in the northern towns. We will be everywhere with mobile testing. Our regional testing data, let's look at it. Let's see here. Let's see. Okay. What do we got? That's a big number. All right, so we had 1,743 yesterday as a region. Our 7-day average, looks like 1,215. Again, really strong numbers. I want to thank our partners in Cayuga County, in Cortland County, Madison County, and Oswego County, all doing more testing. We're doing more testing. We'll continue to meet these numbers that the state has put in front of us so that that metric is not holding us back from any potential phase in restart. Again, 775, that's the 7-day average you need to have per day, over 1,200. So very, very strong testing. The region has responded very well. Hospitalizations, 61. up 2 from yesterday, represents 9% of our active cases. We have 17 neighbors who are in critical condition right now. That's up 1, between 2 and 3% of our active cases. Again, let's think about them. These are our neighbors. These are folks who are having a hard time. Let's keep them in our thoughts and prayers. Further detail on those who are hospitalized: 45 Caucasian, 10 African American, 4 of another race, 2 individuals who have declined to share demographic data. We've had 185 people now that have been released from the hospital. That's up 4 from yesterday. Overall, 1,543 positive cases, up 20. Again, that's a very good number when you look at 720 tests coming back, 20 new cases. We are presently monitoring 663 active cases. This is up 3 from yesterday. 796 people have recovered, up 11 from yesterday. 3 individuals are household contacts out of our 20, and 7 individuals are related to senior living facilities. So out of our 20, we had 10 contacts and affiliations, and we had 10 from community spread. Our 7-day average on community spread was about 13 cases a day, so a strong overall 7-day average. We'll see what next week has for us. Again, out of our active cases right now, about 2/3 are related to either household contacts or affiliations related to senior buildings. Why is that important? Because those are situations where the overall everyone is already in a quarantine, essentially. When you look at risk to the general public, community spread is an indicator of the intensity of the virus and the public at large. These are situations where it's easier for our health department to quickly isolate because these situations are really already isolated. We now have 1,688 people in community isolation or quarantine. Again, this number is going to take longer to drop. 14 days for a quarantine. We knew that. 14 days for isolation, best case scenario if you're a senior. 10 days isolation, best case if you're not a senior. Those numbers used to be 7 days. So as the health community continues to learn about the virus, they change and always look for best practices. Those are new CDC guidelines that have changed. 904 of our cases have been female, 639 have been male, 49 are under 19, 244 in their 20s, 188 in their 30s, 195 in their 40s, 235 in their 50s, 208 in their 60s, 171 in their 70s, 160 in their 80s, and 93 in their 90s. Percentage of breakdown: 19% are under 30, 31% are under 40, 44% are under 50, 59% are under 60, and 41% of our cases have been over the age of 60 years old. Breakdown by municipality: City of Syracuse, 819 cases, 357 recoveries. Town of Onondaga, 120 cases, 31 recoveries. Clay, 119 cases, 89 recoveries. Geddes, 84 cases, 24 recoveries. Manlius, 64 cases, 51 recoveries. DeWitt, 63 cases, 46 recoveries. Salina, 63 cases, 47 recoveries. Cicero, 55 cases, 33 recoveries. Camillus, 48 cases, 33 recoveries. Lysander, 31 cases, 26 recoveries. Pompey, 24 cases, 21 recoveries. Skaneateles, 15 cases, 15 recoveries. Van Buren, 15 cases, 4 recoveries. Marcellus, 6 cases, 4 recoveries. Atisco, 5 cases, 4 recoveries. Lafayette, 4 cases, 3 recoveries. And the towns of Elbridge, Fabius, Spafford, and Tully all have had 2 cases and 2 recoveries. Related to some, we're in restart now, but I've had a lot of emails about what this means related to social gatherings. The rule has been 10. You can't have more than 10 people. Certainly, there's risk involved with even having 10 people together. And we know what the risk is. We know we need to be 6 feet apart. We know by wearing a mask that limits the possibility of the spread, whether you sneeze, you cough, saliva, which can all lead to COVID-19. So as we enter into restart, this is really helping to add new elements to the economy. It's important that families, to clarify, you could always see mom or dad. You could always, but it's whether or not seeing mom or dad brings more risk and whether it's the smart thing to do. And so I know for kids who haven't had play dates, and I know this is tough, you're the parent, use your best judgment. Certainly, we don't want, it's tough to have kids when they're together when they're not 6 feet apart. It's just, I'm a dad, I have 3 kids. If their friends were over, it's very hard to be 6 feet apart. And are your kids going to be wearing masks at all times? So these are all things that you need to consider, but certainly the large gatherings still not allowed, haven't been allowed. We're talking with our state partners about ways that things can get phased in, potentially, but your children, you know what's best for your children, and certainly we have faith in you. You've done a nice job keeping your kids safe, but it's very, very hard for kids to be 6 feet apart from everybody. So my own children, they haven't had play dates. They're getting sick of each other, but that's just part of this process. And as we continue to make progress, eventually that will change and we'll be able to loosen things up. But I've had emails, I had questions. I'm a dad, and so I just wanted to give that perspective from what we do in our household, understanding, you're in charge of your own children, but the rules of 10, as far as social gatherings, those are the rules. Let's not break them. Let's live within them. Related to Restart, I'll take questions on Restart. I know we'll have questions, so I'm not going to get into that. And then, again, just a couple quick numbers. Child Care Solutions, 315-446-1220. If you are going back to work, you have daycare challenges, we have slots available. Call Child Care Solutions. And again, 211 for social and emotional support. Public health is bigger than COVID-19. It's about the opioid crisis. It's about suicide rates. It's about mental health. It's about Lyme disease. And so if you need help and you need to get through this process, and this has been tough, please call 211. They can help make referrals. And there's doctors that certainly can help you as well. So questions? This is great. We good?
Ryan, I have a question.
Okay.
So how did today go? How many startup plans did you receive from businesses? And can you tell us about what the process is? Do they have to wait for a call back from your office? Like, how does that all work?
So the process is you go online to New York Forward, and you're going to certify that you have read through the guidelines for your business. And then at that point, you're going to print out your essential reopening safety plan template and keep that template. We are waiting from the state on how many businesses have completed this in Onondaga County and who they are. So if we get a call on a business, we know whether or not they've completed it. And we knew that you get the green light yesterday, today you can restart. We knew that there's going to be a little bit of a lag. We're changing up the way we operate at 911, so if you get a business call, a complaint about a business being open, that's not going to go to SPD anymore or the police department. That's a different enforcement avenue. But we have not heard many complaints today. That doesn't mean it won't. We haven't gotten this information yet to properly regulate it yet. So we're certainly, once we have that information, we'll have an existing database to be able to talk more about how many businesses complied, who didn't comply. If we go out, please comply. Thank you. What we are working on is from the governor's executive order. I will do my own executive order that will give us the ability to fine. I have not seen that final document from the law department. It's probably ready for my signature after this meeting today, but that doesn't mean that's what we want to do, but we need to have that authority for those who don't take this seriously.
What kind of dollar amount are you looking at?
What was that?
What kind of dollar amount are you looking at?
I think it's going to have to be consistent with some of our other health inspection related fines, so I haven't even seen what that is. yet. But certainly, you know, this is, we've been waiting for this. The private sector has been waiting to get back to work. And now this is part of the process. We need to do it safely. More and more of your clients are sitting on the sidelines looking at that May 29th date to try to get going. So how do we get going? We're smart now. You get more clients that can go in phase 2, your business will get better. So the private sector is innovative. The private sector gets this. This needs to be more about them doing what's right for their business and their customers than us regulating and enforcing, because certainly local governments are charged with this, but we've never been in this situation really quite like this.
You said not many complaints. Have there been any complaints?
We get complaints every day, so there's going to be complaints about something every day.
Nothing out of the ordinary related to phase 1?
It's relatively quiet. You know, I would say the mental health of the community at large is a little bit better today than it was yesterday, when related to my unscientific poll through my email inbox.
Would you read that URL again, letter by letter?
No.
I'm kidding.
No. Google, as the mayor said, great advice. Google New York Forward.
The governor took a step today with state-controlled beaches. Do you have a read on what you're doing with county beaches?
Yeah, so we have Jamesville Beach and Oneida Lake Shores Beach. We don't have the resources and time to open both of them up. We're considering opening up one of them for Memorial Day weekend. I went to Oneida Lake Shores myself today to visually see what a plan would look like and how you can do that and still maintain some level of physical distancing. And it's an interesting plan. And Dr. Gupta's here today. She's going to get the plan. She's going to tell me if she likes the plan or not. But certainly we know that we're looking out at the forecast. We know it might be good weather. That leads to pressure. So if we can't do it safely, we're not going to do it. But we're considering opening up one of the locations.
As the weather's obviously getting warmer and nicer, people, of course, are going to want to go outside, but our social distancing score is an F, and it's been a low score for some time now. So just kind of two parts here. Is there a concern that it could go lower than that? And then also, can you just kind of define what your message is as far as social distancing?
Yeah, so, you know, these scores are tough now. In the beginning, it was something where we were really just dying to have some sort of metric we could use, because who would have thought 2020 would have been about physical and social distancing, right? So unicast, I think, is what has been used. Now, when you look more and more at the metrics, they're a little unfair to communities like ours related to traveling with miles back and forth. So we've had really good days, but you know, for the most part, our scores, according to Unicast, has been horrible for the last 3 or 4 weeks. But our data is still strong. 10 community spread cases. That's a nice day. So I think overall, I don't know if that reflects what's being accomplished by the community. Tomorrow's going to be a challenge. It's going to be one of those days, but we need to be smart. We're all smart. We all know what we can do to keep this virus at bay and out of our households. We've done it. We've flattened the curve. The curve's flattened. We did that. So if we want to continue to keep that curve where it's going and keep this out of your own household, which could be disruptive to your health, your family's health, and your economic health, let's be smart. 6 feet, masks, let's do it.
Ryan, the deaths we had today matched the single highest death toll we've had so far, 6 deaths. And it's the first day of restart. So how do you square those two things? It sounds like it's obviously very somber news on what is also a hopeful day.
Yeah, I think it's a mixed bag. And every day, if you look at it, when we come up here, there's information that can be hopeful and there's information that's painful. And so for the families that just lost loved ones, this is a very bad day. And for us, that's part of the balance that we have to do when we're assessing where we are as a community. But Terry, when we started seeing these cases where they were four or so weeks ago, we knew these days were going to be here. You're talking about people, many of them at the end of life, many of them struggling with other medical conditions, and when this thing, you compound this virus and how lethal it is, we knew that there would be days like this, and the mortality rates we had in the beginning of this process were not going to be sustainable because of that. So for me, it's very painful. For our health department, it's very painful, and certainly for the families. At the same time, when you put this into perspective of the overall fight with COVID-19, our mortality rates are very low. The spread and infection rates have been very low, and we continue to have the infrastructure in our hospitals and within our own health department to do what's necessary to treat the sick and to test and trace and isolate and quarantine. So overall, even though we're losing members of the community, that's not reflective of our ability to fight the virus in real time.
Were these at more than one nursing home?
We don't know. I'm going to make an assumption that it is, but we don't know. We get this information from the state website, and again, we don't even know what this means. We know that these folks lived in a nursing home. This was their home. It's what they called home. They're not with us today. They died. They had COVID. Was that what we're making an assumption? That's what drove them. But did something else happen? I don't know. We don't know anything else about the demographics of these people, although I will say that many of these families have reached out to me personally and told their loved ones stories, and that makes that very real. For us in our office, a lot of these people aren't strangers.
We know the numbers from the state in different areas have lagged throughout this entire process, whether it's number of cases, number of tests to get to phase 1. When you go to the state's website, it is the latest number for deaths in nursing homes. Do you know, though, if those people literally passed away between now and yesterday at 3 o'clock, or could their numbers be a few days behind also?
I don't know, Andrew. I'm assuming that there's been a very large spotlight on this situation, and I'm assuming that this is pretty accurate, real-time data.
Can you kind of talk about your opinion as far as hair salons and barbershops being able to open in phase 2, and then also tying in social distancing again? If I'm the owner of a hair salon and I see a lot of people out at the parks this weekend, what would you say to them who may be concerned that they will never be able to reopen if people aren't social distancing?
Yeah, I think for the business owners, again, we're getting a lot of these business owners reaching out to us. These are they're not employees. They don't qualify for some of the benefits that other people qualify for on unemployment. So they've really been hit hard. We were looking at where they stood. We wanted clarification. Was there a way that they could have operated sooner? The state clarified today phase 2. So phase 2 is May 29. So I think they need, because there will be a spotlight on these businesses due to the direct interfacing with each other, they need to have their PPE ducks in line. Is there ways for the salons that do the, I'm being told that there's ways to do the manicures and pedicures very safely. I've never had a manicure or pedicure, but I'm being told this can be done very safely. So let's make sure that that can happen. And certainly, let's do everything we can to get everybody going. That's one. I didn't know if you were marketing this angle to the public at large, but if you want to get your hair cut on the 29th, which I do, physical distance for the next 14 days. Is that what you're getting at? Smart.
You mentioned yesterday you'd have inspectors today, just starting their work. Did you send out inspectors today?
Nope. No, we got to get that list. Until we have a list, unless somebody called us with something that is crystal clear, not in phase 1 that they're operating, we aren't going to go out there yet. We need to give this a couple days to settle in, get the information before we really look at our regulatory platform.
Was the state willing to give you that list eventually?
Yeah.
They seem responsive to
yeah.
that?
In our command group, with the county leaders and the mayor and the state. We talked about that. That's information we need. A, because we know everybody's want to know how many businesses, and B, if we're going to enforce if they've done this and attested to this. You have the information. You need to share it. So they get it. They get it. We'll get it.
Do you have a phone number that you said you were going to create?
Yeah, our economic development number is going to be the number, I believe it's 435-3770 for questions related to restart, what phase you fall into. Again, from a regulatory standpoint, we will give out that number next week. We're not in a position to regulate this at this point, so there's no point in giving out a number.
Now that this region's open and some of the surrounding regions are open, but the whole state is not yet open, are you concerned about people coming here for different things?
Well, looking at some of the offensive comments about Central New York from other parts of the state, I'm not as concerned. Let me tell you where Central New York is to our friends in other parts of the state. It is where the smartest and toughest people in the state live, so they can figure that out. But yeah, I don't think people are going to travel here to do something here when it's easier from downstate to go to Connecticut or New Jersey than to come up here. If they're coming up here, they probably own real estate up here, and that's, they're property owners, they're taxpayers, they're members of this community. So I think from the travel end of it, I think we're okay.
You mentioned May 29th as the earliest Phase 2 could go into effect. Is that simply realizing that these phases have thought to come in 2-week intervals based on good behavior?
Yeah, 14 days. So we'll monitor everything through the 14 days related to the metrics. We'll closely monitor trends and cases, just like we have been, and then we'll make decisions around that. So, right now it's a good way. Today was a nice day of cases to go into this. A nice average. Now we're putting a little bit more density, folks together, some nice days. Let's keep things going in the right direction.
Is the 2-week, 14-day thing, is that part of the state's conversation with you? They're on board with that thinking that phases come in 2-week intervals?
Yeah, everybody agreed. That was the plan. That was in our plan. State agreed their plan. Why 14 days? Because it takes 3 to 5 days for this to even show up if you get this virus many times, and then for our health department to see a trend, you're going to need at least a week worth of data, and then after that trend is when you would potentially see after a week if your hospitalization rates then start to move up, because remember, many people get sick, they're okay for a couple days, and then they get very sick.
Are the test times still coming back pretty quickly? Because I heard Wadsworth's a little slowed down right now.
Yeah, so we've been working mostly with private labs. Wadsworth worked with some of the upstate hospital, and certainly Wadsworth is kind of the gold standard for labs in New York State. So there's hope that with all this nursing home testing, considering how important it is that you could use Wadsworth to get everything back really quick, but they're being inundated with testing from around the state now. So we've teamed up nursing homes with different labs. We've managed that process for them, and we continue to do that. So they'll be meeting their mandates, and certainly we haven't seen a backup in a logjam, really. When you look at the amount of tests we've had, we are getting a lot of tests back every day.
I think that, today has, like you said, has been kind of a hopeful day for people. Phase 2, 3, and 4 doesn't seem so far away anymore, but how important is our behavior the next 14 days, and like how critical is it in order for us to get to phase 2? I mean, because we could potentially slip backwards if we don't keep up, right?
Yeah, I think look at the metrics that we can control are going to be fine. We're going to test, we're going to trace. The metrics we can't control, the hospitalization rates, we need the community's help on that. And we need you not to get sick. So how don't you get sick? Well, you keep 6 feet, from each other. You wear a mask when you're out in public if you're going to be within 6 feet. Wash your hands every 10 minutes like Dr. Gupta does. And then, you know, you'll be in good shape and nice and healthy. But that's what's going to drive the hospitalization numbers. We can't control that. I feel for my friends in Western New York because that's what's holding them back. And certainly that's something that's really out of the county executive can't control who's going to the hospital. So, you know, things we can control, like we did, we promised you we'd do this, right? We exceeded expectations. Trish, our testing numbers more than what we told you they were going to be. But this is where we need the public to really continue to perform at a high level, which we have over the last really 5-6 weeks.
If you could predict what this weekend looks like now that the weather looks pretty decent and phase 1 is underway, what do you hope for the community?
Yeah, it's going to be, I think tomorrow is really nice. I think, was it last weekend was really nice, or maybe the weekend before. You know, let's enjoy the weather. Everybody's earned that. Do it in a smart way. And, you know, live your life in a smart way. This is what it's going to be like, whether we're at work, when we're home, a little more freedom. But when you're out in the public, you don't know who your friends have been with. You don't know who they have been in contact with. Until we know more about the virus and what it's going to do and how it's going to behave and how we're going to treat it, we just have to be super diligent. And if we're super diligent for 2 weeks here, we'll get to the next part of this process. And that's when I think from a mental health and emotional part, people will feel good. But this is going to be with us. And you know, what we're getting there. We're getting there every day, but we can't go 2 steps backwards now. We just can't.
Sorry, Ryan, I know you don't have a list yet, but do you have a sense of how many businesses here opened? A couple dozen, as many as 100?
Oh, I think you're seeing hundreds of business open. I don't have any data to back that up, but I just know that there was, from the businesses that were on the sidelines that met these categories, you're talking about thousands. So maybe you didn't have thousands open in one day. They're waiting to get things through. But certainly, I think you probably had hundreds of open up.
You mentioned yesterday, I want to clarify, businesses that had already been opened, deemed essential, they have to go in and retroactively fill out this state form?
Yes.
What I can see on the form, that there's no healthcare category. Some of the obviously essential things, there aren't categories for that.
Yes, that's correct. So do you have a specific one you're looking at, or?
You could say healthcare. You could
Yeah,
say
I think with healthcare, again,
reporters.
they're looking at, certainly, there's been the certain things are now opening up. Surgery centers, there's been, all surgery centers are open now. Your eye doctors are okay. Your dentists, it's still emergency, preventative emergency situations, not routine situations. So these are all things that have opened up, and that these businesses have to go and attest, even if you're only operating, you know, for root canals as a dentist. You know, these are all things that the state has given guidance that you have to do.
But where do they attest to that? I guess is my question. The logistics of going to forward.newyork.gov doesn't have categories for those groups.
I haven't gone through that to that detail, Andrew.
Okay.
So if they can't attest, I don't know where that you would attest then if you're not allowed to. That is not my page.
No, I know. You just said
Yeah.
that yesterday, so I
Yeah.
didn't know if the state gave you more information.
No.
Ryan, can you set expectations for the zoo? I mean, it seems like right now it would be phase 4, except that it is a little bit special that it's a park, and
Right.
perhaps there could be some social distancing.
Yeah, so we have a plan right now that our health department's reviewing. Again, municipal-owned operations don't fall under the same phases that the state has put forward. It's really our discretion. Certainly, we're going to have Dr. Gupta and her team review that plan and kind of see how phase 1 goes. And then potentially that may be a situation just like libraries where we're opening them up, but we're doing it strategically and in phases before we get to full capacity, where we may do the same thing at the zoo. But certainly when the plan is approved that this is a good sound plan, then we'll look at probably some sort of phased-in approach.
So it's possible it could be earlier than phase 4?
Correct.
Okay.
Correct.
I think some people may be wondering like how long social distancing will last. Obviously, we have the 4 phases, but do you think we'll have to social distance way past like phase 4? I know that seems kind of far away, but what is your opinion on that?
I would say today, knowing what we know today, and this could change, but yeah, I think this is what life is going to be like for a while. And so the year of 2020 is going to be a year of understanding the upside to physical distance and social distance, and the upside of wearing a mask, even if it's a cloth mask. And if the virus changes course, we'll know, and then that will change our course. But right now, it's here, and we know how we got to fight it. So I would not be under any expectation that physical distancing in any of these phases, even when we get to phase 4, that won't be something that we can just throw out the window. Any other questions? Okay, tomorrow's a nice day. Let's have it be a county-wide day of yard work. That way you can keep yourself physically distanced away from others and enjoy the weather, maybe get a tan, but certainly let's be smart as we enter in this new phase. We've gotten to phase 1. If we want to get to phase 2 in 14 days, we need your help. So please enjoy the weather, be smart, and be safe. Thank you.